Well, hello, hello. Welcome back to another edition of Surviving and Thriving in a Pandemic. I am your host, Pastor Sharice Cross, and today we have another great topic. Today we're talking about stress, hypertension, diabetes. We're talking with someone who is an expert in these areas. So I want to introduce you to our expert today. His name is Dr. Daryl Sherrod. He is a family practice physician. He specializes in hypertension and diabetes. He also is a native here in Decatur, Georgia, and he has also been named for 2020 and 2021 Atlanta's top doctor through Atlanta Magazine. We want to welcome Dr. Daryl Sherrod to the show today. Welcome, Dr. Daryl Sherrod. We're so happy that you're here with us today.
Thank you. Thank you for having me. I appreciate it.
Thank you for being on the show today. So, Dr. Sherrod, let's just jump into it. I'm so
Mhm.
grateful, first of all, that you're one of Atlanta's top doctors, named in Atlanta's magazine. That is not just something that's voted on by just anybody. That's by your fellow peers and by people who have been seen by you. So that's really a good honor. It's a great honor.
Thank you. Thank you. It is. It is. Just doing what I love to do. I love taking care of patients and diabetes and hypertension because it runs in my family and I have so many friends and who have it. It's very, very near and dear to my heart.
So thank you. You just gave me a great segue. I want to see what was it about hypertension and diabetes that you went to that path when it came to your call.
Again, my mother's side of the family, and as well as my father's side of the family, both of them have hypertension. So understanding hypertension, the causes of it, prevention, treatment, has always been interesting to me, as well as diabetes, which runs on my mother's side of the family. Lost several family members due to diabetes, from heart attack, stroke, watched family members on dialysis and the consequences of that. So learning the disease process, how to treat it, and prevent some of the comorbidities was important to me.
Very good. Wow. So, and I love that when it comes from that heart and comes near dear, and you can help out. That's where that passion. It just seems like it blooms. So
It is.
let's get into it then. Well, let's talk about it. Would you mind explaining what is hypertension? We hear it. I've heard it, but what exactly is hypertension?
So hypertension is a measure of the pressure in the arteries. So increasing pressure in the artery damages the arteries, and that process causes the arteries to narrow. And in narrowing, the arteries decrease the amount of blood supply to certain organs. So if you get a narrowing that goes to your brain, that's what causes a stroke. Narrowing to your heart causes a heart attack. Narrowing to your kidneys causes kidney failure. Narrowing to your extremities is what causes amputations and things like that. So high blood pressure is a matter of controlling that pressure with medication so that the pressure inside of those arteries is low enough that it's not doing damage to the arterial walls.
Wow. So it's very important. I see that we should be concerned about hypertension. Now I
Most
hear
definitely.
two different two different terminologies. We have hypertension and then hypotension. What's
Hmm.
the
Hmm.
difference?
So hypotension is low blood pressure. So that usually happens
Mhm,
sometimes if you're sick, like if you have a
mhm.
really bad infection and your blood pressure will drop too low. And when your blood pressure is too low, you don't get enough blood supply to your organs. So we have a decreased blood supply to the organs, and that damages the organs. So you don't want hypotension. And hypertension, again, is too much pressure in the arteries, which damages the arteries and decreases blood supply to the organs as well. So you really want normal tension or just a normal blood pressure.
So a balance of it all.
Correct.
So
In between.
I've heard that well, I know that that's one of our top five um, disparities that we have in the African American community, even particularly here in Decatur.
Hmm.
Hypertension is a major issue for us, even pre-pandemic. And I've
Hmm.
even read just recently in a study that was done between 2018 through 2020 that there's been an increase in hypertension amongst just Americans in general. Can you speak to
Hmm.
that?
So as far as us, one of our things is our diet. So we have a high salt diet. And African Americans, increasing salt causes us to retain fluid, and that starts to also increase your blood pressure. Another disparity probably for us is that we don't go to the doctors regularly, so
Mm.
and probably African American men are probably worse than African American women, but we just don't go get regular checkups. Most people assume that when their blood pressure is high that they'll know, and that's false. Your blood pressure can be through the roof and you feel totally fine. So that's another thing. So we don't check enough. Probably lack of compliance, medication compliance, not exercising on a regular basis is another factor. Our diet, sedentary lifestyle, obesity can potentially be a risk factors. So a lot of those things, unfortunately, are against us in our community. During the pandemic, that's probably gotten worse. People are staying home more so. They're eating, making unhealthy choices in their diet there. And they're just sedentary. They're gaining weight, I think they call it the pandemic 10 everybody's getting, so, and that extra weight gain also affects, affects your blood pressure. So.
And I could totally relate. I really can. I've done some stress eating. I've sat there. I've had to really get myself back up and get to moving, and it's felt better. But there is so many who have not been able to get up or have that motivation or even drive. And so I can definitely see how our blood pressure has extended and come up. And so, and you also mentioned that we're not, even pre-pandemic, we weren't really visiting the doctor, especially our male counterparts. So now, is it okay? Because I know we have all been kind of fearful. Well, I've heard that people are fearful about going into the hospital. We know the numbers are kind of high right now, but do we still need to get that checkup? Do we still?
So you do want to check up. You want to know what your particular doctor's office's policies and procedures are. A lot of the offices are keeping sick patients out in order so that we can maintain those patients that need their diabetes follow-up as well as their hypertension follow-up. So those patients that may have upper respiratory tract symptoms, we're really trying to push those away. So you just want to know what your doctor's office policy is, so to make sure that you do get the follow-up for that. And every office is kind of operating differently in how they're handling that.
We are picking men's brains today because we're asking men questions that we want to know. Honest answers. Don't get mad at the messengers.
You're changing your looks all the time because you have to keep changing to keep his attention and to keep him from doing it. Then guess what? It's not you, it's the guy.
You're not going to get it all right. Just make sure you nail the big stuff, like making sure your kids are in the right seat for their age and size. Get it right at nhtsa.gov/the-right-seat.
When will someone know that they need a coach?
If you're looking at your life and you're taking an evaluation of yourself and you're not happy with where you are and you can't seem to come up with what you need to do to become happy, then, a life coach may be that individual that you need. Now, if you're just having a rut, just, a week at a time and you can kind of talk yourself out of it or you get over that, you may not necessarily need a life coach. But when you are really stuck and you've tried this and you tried that and it's not working for you and you just feel like you need more, then I definitely believe that a life coach would be someone that you can reach out to.
I've heard people think, well, if I go to the doctor, I'm going to get sick. I don't want to get sick, or I'm going to catch whatever everybody else has.
Yeah. And so one of the things that, particularly in the medical profession, that we're using is mask all the time, in the office, masking, sanitizing, of course. But I think the biggest thing is avoidance, as far as us, is keeping those patients who have symptoms out of the office.
Yeah.
If you're having cough, those symptoms, just keeping those patients out of the office. Just to prevent the possible spread, And then because some patients are asymptomatic, wearing the mask, both of us wearing the mask simultaneously also helps preventing you from spreading it to me and me from spreading it to you.
So I'm gonna, since you open that door, if I do have some symptoms, what do I do?
So, with COVID, and that's why the vaccine is so important. Up until recently, there isn't really a treatment for the virus. Now there are some therapies out there that are somewhat effective, but the best thing to do is symptomatic treatment. That's all we really have. If you're having fever, Motrin helps with the fever, Tylenol helps with the fever. The muscle aches, Motrin, Tylenol helps with the muscle aches. Cough, they're over-the-counter cough suppressants. Some patients require stronger cough suppressants, but it's really based on the symptoms, just treating the symptoms. Of course, unfortunately, some patients, the pneumonia that develops from the COVID gets to a point where they can no longer extract oxygen from the air, and those are patients that need to go to the hospital to be treated in the hospital. But for most patients, the symptoms are very similar to a bad case of the flu. So just like you would treat the flu at home with their symptomatic care, same thing with COVID until it gets to a point that you can't breathe.
Okay, thank you for allowing that question. Yes. So I had another question about gender, and you mentioned it just a little bit about men being kind of hesitant sometimes to come in. What about with hypertension? Are there symptoms that are different when it comes to gender? I've heard that sometimes women, we experience a heart attack maybe in a different way than a male, or our symptoms may be a little different, or even the stroke. Are there symptoms that are different between the genders?
For heart disease, yes. A lot of times, so the classic symptoms of the chest pain, shortness of breath, nausea and stuff like that, those we're seeing typically in males, and women maybe something maybe chest pressure, very vague symptoms a lot of times in women. So you don't always have that classic chest pain, shortness of breath, nausea, vomiting in women that you do with men. So you guys, as far as heart attack, we present a little bit different.
And so what are some, go ahead.
Now, as far as hypertension, with regards to that and symptoms, there's no difference. Typically, hypertension is asymptomatic, male or female. But with heart attack like that, that's where you can have the differences as far as symptoms.
Okay. And so let's talk about the numbers. What are the numbers? What are our baseline numbers? What should we be cautious? What's normal? What's cautious? And then what's concern?
So to make it easy, 140/90 is considered the cutoff, for high blood pressure. So that top number of 140, the bottom number of 90 is considered hypertension. Anything greater than that, there are some caveats, for age and other disease processes that we use, but just for a baseline, 140/90 is the cutoff.
Okay, so 140/90. So if my blood pressure is 150 over 100, I need to come in and get seen, or I should be calling my physician. So should I have a monitor at home? Should we be having blood pressure monitors at home, or how often should we monitor our blood pressure?
So it's recommended at least once a year that you have your blood pressure checked. Starting in our early 20s, really having the blood pressure checked annually. Once you're diagnosed with hypertension, it's good to know what your blood pressure is running. So that if your medicines are effective. To make sure that you're staying below that cutoff. But just in general, for the general population without a diagnosis of hypertension, a blood pressure screening of once a year is what's recommended.
Okay. And so are there ways I can reverse that? Is there ways I know you talked about the veins narrowing. Is there a way for me to fix those, help them expand or help them rebalance?
So as far as it's the arteries that narrow, and that's a consequence of uncontrolled disease over time. So that's not an instantaneous thing. African Americans are genetically, for whatever reason, more predisposed to hypertension. We don't really truly understand all the reasons why that is, but it is that we are more predisposed to it. So things that can help with that, exercise and diet are crucial, prevention. So exercising on a regular basis can help lower your blood pressure. Watching your weight, obesity has the potential to increase your risk for not just hypertension, but also with diabetes as well. So watching that, your salt content is another way that you can kind of help. And then some people, they can do all those things and still develop hypertension because of the genes in the family.
Wow, that's good. That's good to know. So diet, watching, exercising, making sure we're exercising our heart, but also
Mhm.
trying to lose weight.
Correct.
So
You all know him, my boy, Will Smith.
His tone is a very conversational tone, and he has the ability to be a storyteller because he is a actor. And so this book was more of a page turner.
I really enjoyed hearing and listening to him narrate the book. Also, I think it was a really great book because he was just so open and honest. And I mean, I don't think he really left anything out. I mean, he talked about everything in the book.
And I just want to throw this out there, that this is basically one of my favorite memoirs. And you know how I feel about the other book that I have read.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/therightseat to make sure I'm in the right car seat.
I'm gonna call my dad.
We are picking men's brains today because we're asking men questions that we want to know. Honest answers. Don't get mad at the messengers.
You're changing your looks all the time because you have to keep changing to keep his attention and to keep him from doing it. Then guess what? It's not you, it's the guy.
if you can differentiate, because sometimes I hear exercise, we need cardio. We hear cardio, cardio. What does the cardio do, and why do we need to do it? And for how long?
So cardio, just like it says, works the cardiovascular system. So it works the heart, it trains the heart. So if you look at patients or people who like marathon runners, their cardiovascular system is very efficient at pumping blood. So those marathon runners will have heart rates like in the 40s, 50s, and stuff like that. So a normal heart rate, what we consider normal, is between 60 and 100 is considered normal. But those particular patients, the marathon runners who do a lot of aerobic exercise, their hearts are just much more, I don't know, in shape, I guess you could say in shape, but they're more efficient at pumping and getting circulating blood, so it's less work on them because of that. And so that's what you're really aiming for, is just to help condition the heart. And studies have shown that just 30 minutes a day of cardiovascular exercise can help improve the heart.
And so if we're asking, because we are asking our members to walk 30 minutes a day, is that enough?
So that's strictly cardio. So that's just helping condition the heart. So that's good for that part. Now, when you start talking about weight loss, you actually may need a little bit more for weight loss and a little bit more intensity for the weight loss. But just for the cardiovascular, 30 minutes of a nice brisk walk is what's recommended.
Okay, great. So cardio, because I think sometimes we think, okay, if I do cardio, I'll lose the weight. But the cardio is really to exercise this muscle, our heart muscle. So that's
correct. But at the 30 minutes, that's what that one's for. So when you talk about weight loss, that changes a little bit.
So we need to increase the time and the intensity. Is that what I'm hearing?
For weight loss, yes, ma'am.
Okay. Okay. And so as we're coming through and we're getting older, let's talk about the different ages. You mentioned starting at 20. Is that when we start our baseline, or what age should we start our baseline?
So the 20s when you want to start at least your annual physical. And unfortunately, between your 20s and your 40s is probably the healthiest time you are in your life. but also that's when the changes that's going to affect you later on really start to occur. So by keeping track of those earlier, at least on an annual basis, you can kind of guide yourself into a healthier path. But if you don't do that, you don't really know what your blood pressure is running, you don't know what your cholesterol is running, so you don't know those parameters until there is a problem. So there's not the opportunity for prevention is not there because you're not coming into your 40s or 50s once there's a problem. So at that time, we're treating the problem versus an attempt to prevent the problem.
Absolutely, absolutely. And so I'm thinking about men and women, as you mentioned, coming into our 40s and 50s. Women are becoming premenopausal or menopausal. Men's testosterone is lowering or decreasing. There's some hormonal shifts of both, right? So what do we need to be looking at and doing during those times?
So, and that's why I was encouraging patients. Your annual physical is typically kind of like your checkup on your car. So you take your car in and they do the 30-point checkup and stuff like that. It's the same thing. So our bodies are machines as well, and we have to monitor. So there's certain things that you can monitor with a self-monitoring. You can feel, excuse me, like you can feel chest pain. Those things you can feel, but the other changes that are going on that you may not be aware of, that we notice through blood work and exam. And so that's why it's important, just like you take your car in to get it checked to make sure everything's running properly, that you take your body in to get it checked as well.
Wow. Okay. Well, Dr. Sherrod, is there anything you want to tell people or let people know that you don't get to say and you wish you had a loudspeaker and you could tell everybody? What are some, give us like at least 3 or 4 things we need to be doing that we need to do and then we need to stop. Yeah.
So in general, if you look at several disease processes, invariably exercise is important in prevention of so many disease processes. So regular exercise, a regular routine of exercise is definitely important. Dietary changes are crucially important, not just for our weight, but for prevention of diabetes, cholesterol, heart disease later on. So having a healthier diet. There are also some studies that also show that our diet can also be changing our diet can be instrumental in the prevention of certain cancers. So that's also important. So dietary changes, exercise, annual checkups. So many things can be caught early by screening, but unfortunately, a lot of times we don't. We wait until it's broken to go. And then we got to try and fix a problem versus prevent a problem. So by annual screening, a lot of times we can catch these things and hopefully prevent them. What else do I fuss about? So I think another thing probably that I really encourage our patients is compliance. Work together with your physician. If there's something that you don't agree with, you don't like, let your doctor know. So I often tell my patients that you're the pilot, I'm the co-pilot. If I tell you there's a mountain ahead and you fly into it, that's you. My job is to advise you and direct you. Ultimately, the decision is yours, but we need to make an informed decision together.
That is so good. Thank you for you're letting us be the pilot, but you're advising us on where we should go. You're like the navigator. Like
exactly.
We don't listen, then hey, okay, so. But I thank you. They weren't bad. Those are good points. First of all, those are good points. We need to know that. So we need to get our annual checkup. We need to make sure we have a healthy diet, and we're going to talk more about that in our next segment. And then make sure we're listening. So if the expert gives us the advice, we got to take it. We got to take it. So and then get that annual checkup. I'm so I know like many people the first year, 2020 was a blur. Just went by like that. 2020, I don't even know. I'm already in 2022. But 2021, I started to go back, and I think a lot of people started to come back into the doctor in 2021. And so now I think people are starting to get a little bit more comfortable with coming back into the hospital. So if you have not been to the doctor, please, please, please call your family physician, call your primary care physician and get your appointments and start to get your checkups because you do need them. They are vital and they are making sure that you're safe when you go there. So that is good information. We spent just this moment talking about hypertension, but we want to get into diabetes and we're going to touch on that in our next segment. So we want you guys to come back and listen to our next segment. I thank you, Dr. Sherrod, for coming on the show. and talking to us about hypertension. And we will be back, you guys, so come back and hear about diabetes. Thank you again.
You all know him, my boy, Will Smith.
His tone is a very conversational tone, and he has the ability to be a storyteller because he is a actor. And so this book was more of a page turner.
I really enjoyed hearing and listening to him narrate the book. Also, I think it was a really great book because he was just so open and honest. And I mean, I don't think he really left anything out. I mean, he talked about everything in the book.
And I just want to throw this out there, that this is basically one of my favorite memoirs. And you know how I feel about the other book that I have read.